As a pediatric nurse practitioner, I've been working with childhood immunizations all of my career. And after reviewing the World Health Organization information, I see the great importance it has for adults as well. Vaccinations have been estimated to have reduced about 6 million deaths worldwide. And in the U.S. alone, since vaccines have been used widely, we've got about a 99% reduction in 9 childhood illnesses. Prevnar vaccine was started in 2000 and routinely given for children, and it prevents streptococcal pneumoniae, which is pneumonia. The great thing that we've seen since the beginning of the Prevnar vaccine is that we've had a great reduction in pneumonia in adults, translated into grandparents and parents and people that are loving and holding those babies. We've decreased the number of pneumonia cases in children, and that has decreased the pneumonia cases in adults. Some children cannot be vaccinated. If you're under a year, it's too young to have that particular vaccine. There are many others that are safe, but it's not recommended for under a year, the measles vaccine. So if you're under a year, you're at risk to get measles if you're exposed. Now, if the rest of the population that can be immunized gets that vaccine, it's protecting the child who is too young. There are other instances where we can protect others by being immunized. If someone has an illness like leukemia that they cannot have a vaccine, they're protected if everyone else that is asked to get that vaccine gets it. Elderly people who are at declining health and may be at higher risk, people with cancers, they are higher risk for getting an illness, and we can protect them. The general population can protect them by getting the immunizations at the proper time. It's really been proven that the decrease in death rate and decrease in illness rate, morbidity and mortality, are reduced because of vaccines. And that translates to a lower cost for society by protecting the individual and not having the further cost of the illness. The cost of a vaccine is so much less than the cost of a hospitalization if a child or an adult needs to be hospitalized, but it also can be looked at as a savings with parents who may need to work and they're not home with their child for that week or longer when their child is ill from an illness that could have been prevented. Vaccines are very safe. In fact, they are safer than therapeutic medications that we give. So when we think about taking a medication for an ear infection for a child, that medication may cause more harm than a vaccine would cause. And yet our perception of the vaccines is skewed, and there's a lot of misinformation about how they can be dangerous. They are very safe and they are very protective. Look at smallpox being eradicated. That's the main illness we've seen that's been eradicated by vaccine. But we can get there with other illnesses if we keep our vaccination rate up.